So the first thing that I like to do is to use a very small round diamond burr to pierce through the enamel and get access to the lesion. We can see here in the image we have a very good view of the actual cavity of the actual lesion. And the next step after this would be to clear the contact point. So using the same diamond burr, I proceed to open the contact point from the buccal to the palatal aspect of the tooth in a lateral way, so to speak. The one of the main principles of cavity preparation in a class 2 cavity is indeed the clearance of the contact point. Doing this will enable us later in the procedure to fit a matrix band and to fit a wedge as well. The wedge will obviously allow the proper adaptation of the matrix band to the margins, especially to the gingival margin of the tooth. The clearance of the contact point has also will give us the advantage that the later margins between the restorative material and the walls of enamel or the walls of remaining tooth will be in an area that are accessible for polishing. So in the next couple of minutes you'll see me clearing the contact point and removing decay from the junction between enamel and dentin at the gingival level, and this is achieved by using a combination of high speed and low speed burrs. Once the clearance of the contact point has been achieved, I can then go back into the lesion with a low speed rose head and start removing the affected dentin or the soft dentin. We have to remember that once decay reaches or passes from enamel into dentin, it will advance at a wider front, which means it will undermine enamel. So in this image you can see me using a larger diamond burr to remove all unsupported enamel at the occlusal surface of the tooth. And once this is done, we can go back to our gingival floor margin, which will also have unsupported enamel, and you'll see me here next switching back to the smaller diamond burr to remove the unsupported enamel at the gingival margin of our cavity. Unsupported enamel can also be removed by the use of hand instruments. Here I'm using a probe. Any unsupported enamel has to be removed, as this will most likely fracture later when the restoration is complete and the tooth is back in function. So here again we go in with a rose head to remove even more soft dentin, and this will create even more unsupported enamel, which will then be again removed with either hand instruments or rotary instruments. We can also use a very thin fissure burr to give the final trimming of the margins of enamel, the fine tuning of the cavity, so to speak. Once that's done, we can see here there is much better adaptation of the matrix band at the gingival floor. And even at this stage, I can ensure either with hand instruments or rotary instruments that there are no edges of unsupported enamel. A rose head, a very small rose head, can go back in onto the margins to remove any unsupported enamel. And indeed, it can also be used to remove any soft tissue, gingival tissue that has been trapped in between the edges of the cavity and the matrix band. This particular patient is a young patient. He's on his in his mid-20s, and you'll see me here performing something called a pulp cap with the use of calcium hydroxide. Younger patients, we all know, that have larger pulp chambers, and the dentinal tubules will be wider than in an older patient. So the use of calcium hydroxide will initially cause sclerosis of those dentinal tubules. The calcium hydroxide, as I've mentioned before in other videos, has a very high pH, and this will inhibit the growth of bacteria. And the overall result of using calcium hydroxide is the reduction of sensitivity, post-operative sensitivity, and also the reduction of possible complications like once the calcium hydroxide has set, the tooth is then etched and washed and dried, and we can move on to our bonding, to the placement of our bonding material. The bonding material should be used at least 2 or 3 times. 2 or 3 layers should be applied. The advantage of using a bonding material on dentin is that it will create a hybrid layer. This hybrid layer will also reduce sensitivity as the bonding material will enter the dentinal tubules, and as such it will seal them, and also will reduce sensitivity, and it will also reduce the possibility of pulpal complications. Some practitioners indeed advise the use of bonding material 3, 4, or 5 times. I personally use 2 or 3 layers every time. Some practitioners, as I said, advise the use of more layers, 5 or 6 times. After the bonding has been completed, we can then go in and restore the cavity. The initial layer of material should always be a flowable composite material, as this will seal any irregularities in our cavity, and immediately after that a regular composite material can be used on top of that flowable material that was, or that has already been set with the use of the light. So the initial packing of the material will ideally rebuild the contact area with the adjacent tooth. Here you can see I'm using the probe to refine the margins of that marginal ridge to have a proper contact point and reduce the amount of material that will have to be polished afterwards. As mentioned before, the interface between the restorative material and the walls of enamel should always be in an area that's accessible for polishing, and this is achieved by the clearance of the contact point. Once the marginal ridge has been rebuilt, or the contact point has been rebuilt, we can start rebuilding the cusps of the tooth. And once the restorative material has been placed in its entirety, we can then start the polishing of the material. This can be done with a high-speed burrs, and also low-speed rubbers or polishing stones, and also with the use of interproximal polishing bands. And we can see here our final restoration with a proper contact point with the adjacent tooth. The occlusion is then checked and the patient is discharged. I hope you like this video. If you have any questions, please leave me a message, and I'll promise that I'll be posting more interesting cases. If you like my videos, please subscribe to my channel, and as I said before, if you have any questions, please drop me a message. Thank you very much.